while cutting vegetables, and she needs a laceration repair.
Oh, okay. And you want me to do the repair? Well, I've only done repair in the lab and not on a real person. This makes me extremely nervous.
I can assure you that this procedure is very simple and it will only require a few stitches. This repair is the best scenario possible for your first actual procedure.
Still, though, I'm just not sure.
This is the best first suturing case. Let's go over the procedure step by step. Carefully evaluate your laceration and irrigate it with saline to wash away any debris. Next, use local anesthetic to numb the area. Marcaine would be appropriate for this size of laceration. You can definitely close the wound with single interrupted sutures. Place the skin at a 90-degree angle. The suture is drawn through both sides of the wound with 2 to 3 centimeters on each side. You will then secure the knot and cut the ends, leaving a 3 to 4 centimeter tail. Lastly, you will dress the wound, and that's it. Simple, right?
I can't do it. I'm sorry. I actually have a disability. I have osteoarthritis in both my hands, and I cannot perform this procedure.
Why is this the first time that I'm hearing about this? Erica?
Okay, so we'd like to identify the ethical and legal considerations at stake in this scenario. Unsafe practices, behavior that places the client or staff in either physical or emotional jeopardy. Physical jeopardy is the risk of causing physical harm, and emotional jeopardy means that the student creates an environment of anxiety or distress, which puts the client or their family at risk for emotional or psychological harm. Unsafe clinical practice is an occurrence or pattern of behavior involving unacceptable risk. Clinical failures often result in the termination not only of the course, but also of the student or assessors in a difficult situation. Dealing with unsafe students presents preceptors with a challenging ethical decision for several reasons. This scenario presents a number of ethical considerations, including non-maleficence, informed consent, respect for others, and patient rights. Even as the preceptor creates and seeks out learning opportunities for the student, she should always be cognizant of preventing harm to the patient with the principle of non-maleficence in mind, which consists of avoiding even the risk of harm. The preceptor should also bear in mind that many patients are reluctant to have a student perform their first procedure on them, and therefore there are implications for informed consent, patient rights, and self-determination by the patient. The nurse has a legal and ethical duty of care to the patient as well as him or herself, according to the ANA. Legal considerations. The suturing of wounds is generally not acceptable under the scope of the registered nurse in some states or in most states, but there are states such as Kentucky and Florida that allow the registered nurse to perform suturing and stapling of superficial wounds as prescribed by a documented order of the physician, the APRN, or physician assistant. In the scenario presented, the patient appears to have a superficial wound. The student nurse practitioner is legally a registered nurse and not a certified nurse practitioner at this stage, and may be able to carry out this procedure as ordered by the APRN and under her supervision as dictated by state laws. The student nurse practitioner should be aware of the laws governing suturing by an RN versus an APRN in the state which he or she is practicing. The student APRN is within his legal right to object to carrying out a procedure he does not feel he has sufficient educational training or clinical competence to perform. On the other hand, the student has had some training and would be under direct and present supervision of the ordering APN to carry out this assignment. Both the preceptor and the nurse practitioner student owe the patient a legal duty of care and must provide the relevant standard of care in performing the task of suturing. The legal standard of care is the same regardless if the practitioner is newly qualified or experienced. With this in mind, consideration should be given to the student's level of expertise, as well as the ethical consideration of the student's need to learn and develop his own competence in the procedure of suturing. Thank you.
To identify the decision-making frameworks or models that you chose to resolve this dilemma. We as a group decided that the scope of nursing practice decision-making framework would be the best framework to resolve this dilemma. To promote safety of patients, nurses would use this framework to determine individual accountability for practice decisions, communicate with other healthcare professionals regarding the scope of nursing practice and the nurses' accountability, inform healthcare and other employing organizations about the scope of nursing practice and nursing accountability, educate nursing students about their accountability for practice decisions, and guide professional nursing organizations, credentialing, and regulatory agencies in the formulation of scope and standards of practice, policy, and position statements. Also, we found that accountability is very important. Accountability means to be answerable to oneself and others for one's choices, decisions, and actions as measured against the standards such as established by the Code of Ethics for Nurses with interpretive statements. This came from the American Nurses Association in 2015. Also, to be accountable, nurses follow a code of ethical conduct that includes moral principles such as fidelity, loyalty, veracity, beneficence, and respect for the dignity, worth, and self-determination of patients, as well as adhering to the scope and standards of nursing practice. Nurses in all roles are accountable for decisions made and actions taken in the course of nursing practice. Systems and technologies that assist in clinical practice are adjunct to, not replacements for, the nurse's knowledge and skill. Therefore, nurses are accountable for their practice even in instances of systems or technology failure. This also came from the ANA in 2015. So basically, in other words, it was the student's responsibility to inform the preceptor before starting the preceptorship that he has a disability and won't be able to perform certain duties and tasks.
To identify the appropriate strategies for the instructor and preceptor to respond to the dilemma, respect and dialogue are also vital to the preceptor-student relationship and to the moral space within that relationship. Treating students with respect is an ethical responsibility outlined in the 2008 CNA's Code of Ethics for Registered Nurses. When students feel that their preceptor respects them and cares about their overall well-being, they're more likely to accept the reality of the failing grade and the preceptor's evaluation of his or her performance. Providing the student with feedback concerning his or her performance and communicating with the clinical faculty about the safety issues are essential to the process of precepting students. Further, nurses should question and intervene to address unsafe, non-compassionate, unethical, or incompetent practice or conditions that interfere with their ability to provide safe, compassionate, competent, and ethical care to those whom they are providing care, and they support those who do the same.
Do we need to verbally describe who did what part of the, or is that kind of self-explanatory since we kind of read our own parts?
We probably could, wouldn't hurt.
Mm-hmm.
Does anyone have any questions or comments or concerns about our role play?
You guys did a good job. Oh, that was good.
Thank you.
Very good job.
Thanks.
I guess it's on to Group B.
Oh, okay. So start Group B. Okay. So I am the preceptor. So okay. All right. Can I start?
Go for it.
Okay. So I am the preceptor for Melinda. She nursing student. Okay, so I approached Melinda after our shift, and it goes this way. So, hi, Melinda. I just, first of all, I just want you to know that you are a very pleasant, very competent nursing student, and I am honored to be a part of your learning experience. However, the other day, the charge nurse for our unit came to me and voiced her concern that she doesn't feel your appearance in the clinic has been professional. She's noticed that you wear the same 2 or 3 well-worn outfits over and over. But I want you to know that you are following the regulation of wearing a lab coat over your top. So that's good. But you also know that our university just contracted with this hospital to allow our students to rotate through the women and babies unit. And you know that it is important to retain this clinic site for us.
I hate this school. I think this university is only for rich students. I'm a single mom working a full-time job, and my clothes look the way they do because I can't afford to buy anything else. I can barely put food on the table for my 2 kids.
Okay, so that is our scenario. We'll go to Mel. Okay, where's Melinda? Okay.
The ethics in
go ahead.
this issue, in this scenario, is who it should be, if they should have addressed it at all, who should have addressed it, and legal would be considered discrimination. They need to use, they could have, it needed to be addressed, but it could have been addressed in a much better way. The preceptor didn't need to mention who had the concern and could have approached her in a different way without making her feel like she was being discriminated against and humiliated.
So my part was to identify the are you done, Melanie?
Go ahead.
Okay, my part was to identify the decision-making frameworks or models that were used. I honestly, I really did not even feel like that this was like a clinical, ethical situation. It was more like, I don't know. It wasn't related to her practice. They said she was completely competent, so, but just not dressed well. I don't really understand where that's an ethical thing. But anyway, so we kind of went back and forth. Should it be like, you know, a clinical framework, which I guess then it would be like, if the preceptor needs to ask the question, does this, you know, does this affect patient safety? Is there some regulation in the, you know, nursing association against it, or, you know, something like that? But since it really isn't anything related to that, I'm not sure that those frameworks really work. You know, they could go through like a decision, you know, just a general decision-making thing and consider like, you know, is this girl's feelings worth it? I don't know. It was kind of back and forth. But the one thing we thought was, if, you know, if in order just to avoid any liability of discrimination, because of course the ANA talks about like you're supposed to treat students with respect and all that, everyone with respect. So maybe, sorry, I'm kind of losing my train of thought. oh, maybe have went back to like the clinical instructor or, you know, the school and said, listen, this girl isn't dressed like, you know, how, you know, what we think is appropriate or whatever. Personally, I don't even think anything should be mentioned. I think it could really come back to bite the hospital or, you know, the people who were involved. But that's just, you know, that was just my opinion. I don't know if anyone else has.
Yes, I agree with Dawn. I think that the preceptor is representing the hospital, and I think this is the issue that has to do with the school. I think the preceptor was put in a place where she had no, I would say, no business talking to the student in regards to that. The one thing that clinicians, particularly nurses, have to deal with is this a patient safety issue? If the answer is yes, you have to intervene. If the answer is no, then you just punt this issue to the school, because they are the ones who are supposed to be dealing with uniform for the students. That is just my opinion.
Okay.
One had a very good point about practice decision-making framework would be the best framework for using in this scenario.
Okay, as a preceptor, for me, what are the appropriate strategies for the preceptor to respond to this dilemma? So my main question to this ethical dilemma is, did it threaten patient safety or does it compromise the integrity of the profession? And honestly, my answer is no. This clearly demonstrates that there are no legal implications committed by the student in this case. This student followed the dress requirement and wears a white lab coat over the top, which shows professionalism. There's nothing wrong with wearing old clothes as long as they are clean and presentable. This student should be protected from discrimination based on her appearance, and she should be safeguarded against ethical practices of others. The primary focus of preceptorship is the development of the student's clinical competence. And as a preceptor, it is my commitment to implement appropriate strategies in this situation. So we all know nursing is a very caring profession. And compassion for the student is one factor that leads to a trusting relationship between the preceptor and the patient. I will approach the student by open two-way communication, and I would make active attempts to understand her needs and develop an environment that offers assistance for her needs. I would create an environment that embraces respect, acceptance, and celebrates the uniqueness of every individual. I would exercise the core values of caring and integrity by showing my student respect and support, promoting a climate that encourages her to exercise sound clinical judgment and have freedom to explore and question. Caring actions result in positive outcomes for both colleagues and students alike. So integrity involves treating each other with respect and communicating with one another in a positive and courteous manner. So that's my input there.
Yeah, and I said that too.
So, are there any questions, additions, or comments regarding our role play?
You guys did pretty well.
Yeah, thank you.
Thank you.
That was very good. Thank you.
Yes.
Is that it?
Are there any other questions? Or are we good?
I think we're good.
Yes.
I think we're good.
Okay, I will stop the podcast.
Thank you.
Okay.
Thank you.
Everyone.
Thank you.
Thank you, everyone. Have a good rest of the weekend.
You too.
You too.
Thanks.
You
Bye.
Okay.
too.